We are seeing this, the first wave affected the different age group. The second wave is targeting different age group. The third wave, they're saying like children will be more targeted. On what basis has this been actually done? Why it is like, that targeted groups are being attacked by this virus?
Okay, so like any infection, usually the two extremes of the population are the ones which are more vulnerable to get the infection. That is, if you're to the elderly population and the younger population whose immunity is not as good. So what happened during the first wave, we still we're not sure why kids were less affected, but the fact that the elderly population were more vulnerable. So it was during the first wave, with the people who are above 50 or 60 years who were getting infected. Relatively, people of our age or middle-aged people had better immunity. So what happened after the first wave is that people got infected, and then the vaccination program started, and we started vaccinating our healthcare workers and the elderly population first, those above 60, those above 45. So now when the second wave started coming along, we had our most vulnerable population, which is a 60 and 45 area groups, most of them already being vaccinated. So the vaccine is obviously going to help prevent a very severe infection. So the virus had no other option but obviously to attack the next vulnerable population, which is less than 60, say around 40, 45, who are not yet vaccinated. So that includes your 25 right up to 45. So that is what you're seeing right now. That's the most vulnerable population right now. So now again, vaccination programs currently have also been started for age groups of our age, say around 18 to 45, but still not children. So if, naturally, when the third wave comes around, the entire population is vaccinated other than the pediatric age group or the younger age group. So obviously they become the more vulnerable population to get the infection. That's the major rationale why people are telling that during the third wave, it will be the kids who will get infected. This is how historically also it's happened. This is how pandemics progress. They progress from the vulnerable population, then they get infected, and then they go to the next vulnerable population. So that's how pandemics with influenza viruses progress. And that's